Next talk, we invited Professor Long to present the fertility outcome for HIFU treatment in patients with uterine myoma and adenomyoma. But very sorry, the professor got a severe common cold, so we invited Dr. Chang for was to substitute for the professor to present this talk. So we know the HIFU is a non-invasive management for the myoma and the adenomyoma for the fertile patient. This is very important and maybe very effective method. If we want to preserve the fertility, we almost like to use the non-invasive method, like the medication or the HIFU treatment. But the outcome of the pregnancy, we don't know. But in the Kaohsiung Medical Hospital, there are many experience about the pregnancy outcome for the HIFU treatment. Dr. Zhang, please.
Okay, good afternoon, everybody. It's my honor here to be Mr. Professor Long. And this is the topic I want to tell you today, the fertility outcome after HIFU. And this is Professor Long, very tall and handsome and humorous, but very petite. You cannot hear his lovely voice today because he had a common cold. So back to our topic. Speaking of HIFU, everybody knows that it is very effective in symptom relief and reducing the uterine volume, tissue volume. But for the fertility outcome, there is still limiting evidence. So for the next 20 minutes, I will literaturally review some papers about the fertility outcome after HIFU. So first, take a look for adenomyosis. This is a systematic review in 2019, published in JMIC for adenomyosis after HIFU. And the conclusion is that for reducing uterine volume, reducing dysmenorrhea, and improving quality of life, it is very effective. But to date, there is yet insufficient data for fertility and pregnancy outcomes. In 2017, a systematic review from China also had the same results. From 2000 to 2017, adenomyosis after HIFU, and the result is that symptoms relief rate for dysmenorrhea is very high, from 82% to 100%. But for cost effectiveness and fertility outcome, still must be evaluated. So back to 2006. This is the first case report reporting the case after HIFU therapy and the fertility and gut pregnancy. This is a 30-year-old woman after one session of MR-guided HIFU. And this is her MR picture, a focal adenomyosis, and after HIFU treatment, obvious non-perfusion ratio. And she had very effective symptom relief. And after 3 menstrual cycles, this patient got pregnant and delivered a full-term baby, 3,050 kilograms, and uneventful pregnancy. And there is no structural uterine abnormality. So this is the first case report in Israel in 2006. And in 2015, there is a study in China including 68 women who wished to get pregnancy and had adenomyosis. And after HIFU, 54 women got pregnancy. This is the study from 2010 to 2015. 68 adenomyosis treated with HIFU. And after a median period of 10 months, 54 get pregnancy and the pregnancy rate is 70%. And 21 of them had healthy baby delivered, and there was no uterine rupture. So this study suggests that HIFU not only improves the symptoms, but maybe also improves the pregnancy outcomes. But when we take a look at the study in Korea, this is in 2015. The Korea data shows that in 346 adenomyosis after HIFU, only 6 pregnancies were reported, and the pregnancy rate is 1.74. So the pregnancy rate ranges very, very wide from 1.74 to 70%. This is for adenomyosis, and the paper is very limited. And then let's look for uterine fibroid. In 2017, published in BJOG. This is from Chongqing, investigating the pregnancy outcome of uterine fibroid treated with HIFU. And this study shows that 400 patients with uterine fibroid wished to conceive, and after a mean period of 5.6 months, 80 pregnancies occurred in 78 patients. And these patients, 9 had history of infertility, 13 had miscarriage, and 1 with history of stillbirth. And the pregnancy rate in this study is 19%. And 71 have live birth, is 88.75%. And in this study, there was no uterine rupture or any perinatal, postnatal complications. Another study from Chongqing, also published in 2017. And this study enrolled 189 cases, and with median follow-up of 3 years, and 131 patients got pregnancy. And the pregnancy rate is 69%. And of these women who got pregnancy, 95% was spontaneous conception. And the CS rate is 72%. The study tells that the high CS rate is owing to social reasons, not complications. And this paper is in 2019 from Polish. And this paper focused on the obstetrical outcome after MR-guided HIFU. And in 276 patients after MR-guided HIFU, 20 of them got pregnancy, and the pregnancy rate is 7.25. And as we know, the symptom relief rate is high, 80%. And 11 of them had full-term delivery, with 63% undergoes cesarean section and 4 vaginal delivery. And for complications such as preterm labor, IUGR, preeclampsia, or uterine rupture, uterine injury, there is no complications. In 2018, another paper in China also studied on the vaginal delivery outcome. And this paper includes 174 patients. After 16 months of median period, 88 pregnancy occurs in 81 women, and the pregnancy rate is 46.6%. 84% had delivery, and half of them undergo vaginal delivery. 80% succeed, has successful vaginal delivery. And this study shows that placenta abrasion, placenta remnant, placenta accreta, uterine rupture, or PPH, there is no complications. None of these patients had vagina, none of these patients with vaginal delivery experienced maternal or neonatal complications. So we all have questioned that after we put so much energy on the uterus after HIFU, is there any risk of placenta problems or uterine ruptures or uterine atony? And this paper tells us that there is no complications in your study. in 2017. This is published in JMIC, and this paper focused on the pregnancy outcome after thermal ablation. And this paper, the way they had thermal ablation is radio frequency and MR-guided HIFU. And for radio frequency, 20 pregnancies were reported, and live birth rate is 60%. Also, there is no uterine rupture. And for MR-guided HIFU, 102 pregnancies were reported, and there is little miscarriage rate, just like above general populations, and little complications. And there's also no uterine rupture. Besides, there is also a study focusing on the anti-uterine hormone, AMH. And before and after HIFU, they take a look at the AMH level. And the result is that there is no significant difference before and after HIFU. So there is no change and no effect on the ovarian reserve after patients undergo HIFU. So after reviewing all these papers, we can see that there is very few complications during pregnancy and labor. So in other words, we can say that HIFU is a relatively safe procedure for future pregnancy. But when we look on the pregnancy rate, we can see that pregnancy rate range from 1.74 to 69, 70%. The variability is very wide. And this may be caused by the inclusion criteria, because we do not know the inclusion criteria of the woman. Are they willing to get pregnancy or not? And the quality of follow-up may cause the variability. So this is our data in Kaohsiung Medical University Hospital. Our pregnancy rate is 2.4%. And this is a very raw data because we have 1,700 patients undergo HIFU now. And for this mother group, we did not exclude those who are not willing to get pregnancy. 700 patients are all the women in different age, different family plan. So we did not exclude those who are not willing to get pregnancy. The pregnancy rate is 2.4 in our hospital. This is from the newspaper in 2019, where we have 566 HIFU patients. Until now, we have exceeded 700 patients undergo HIFU. Okay, though there is, it's very difficult to conclude the fertility rate. Still, there is some potential for HIFU for future pregnancy. First, HIFU can precisely ablate the lesion size, which can preserve myometrium and endometrium. And because we did not cut the uterus, so comparing to myomectomy, there is little scar tissue, which can make the woman conceive much sooner comparing to surgical treatment. And the risk of uterine rupture is very low. So when there's pros, there's cons, there is also some concerns of HIFU for pregnancy. First, the effect of coagulative necrosis on the lesion in the uterus is still unknown. We do not know the integrity of the myometrium. Is it affected by the HIFU ablation? And because the lesion is remained in the uterus, we don't know the ablated myoma remain in the uterus. Does it affect the implantation, placentation, or uterine contraction? We did not know does it cause uterine atony or not for the remained myoma in the uterus. So there are still some issues that may need more comparative trials to prove. When we treat HIFU, when we treat infertility patients with HIFU, it is very difficult to figure out the real cause of infertility. We do not know the myoma or adenomyosis. Does it independently contribute to one's infertility? So it is very difficult to draw conclusions regarding the effect of ablation on fertility outcomes. So I think this is what we have to work on in the future to find out and to prove. And that is all for today. And thank you for your listening.